Well, hello, and welcome.
Yes, greetings.
Greetings.
Hello.
Right, so it is Wednesday. It's Wednesday, and that means it is time for the Fertility Family.
Yay!
So, really quickly, I want to just take a moment and say hello to anyone who is watching. Fertility Family is a support group for anyone who wants to have a happy and healthy pregnancy. Now, we do focus primarily on women who may be women or couples who may be a little mature. We look at people who may be having some challenges conceiving. They may have been diagnosed as, having fertility problems or infertility. We don't necessarily believe in that, but we understand, that can be a challenge. So we provide holistic solutions. We are not in opposition to it in any shape, form, or fashion. People going to see their doctors. They go see your doctor. And, we know there's a spectrum approach to fertility and conception and carrying a healthy baby to full term. And what we are here to do is to provide resources and support for anyone looking for some natural solutions. We do actually have some people from the more modern medical profession who will work on the team as well. But what I have found myself inside of my own health journey is sometimes it's hard to find natural health professionals that you can trust and who are qualified and have the resources and experience. So as I've begun my personal journey to mature mommyhood, I'm 42, single, never been married, and I'm planning on conceiving this spring and having my baby fabulous. So excited. I began researching who should I, what to know and who should I have on my team to make sure I'm having a happy, healthy baby. Having my baby fabulous. Oh my goodness. I began researching. I always forget to mute my sound. My apologies. To make sure I'm having a happy, healthy baby. I hear myself. I know this is so weird. Pause. Lovely. Okay, my apologies. So to have a happy, healthy baby. And so my team, I'm creating my wellness team, I'm sharing with everyone else. So with that being said, today I have the pleasure of introducing to you Miss Akilah Shaeed. Now, if you listened to the Fertility Family Live, if you haven't watched that one, like our kickoff event, you want to do that because on that event, I was able to introduce and you get a chance to get to know everyone that was on the team at that time. And guess what? The team is growing and changing. That's one of the things that's so great about it. In fact, I want to let you guys know I'm in conversation with some mental health professionals. Why? Because, conception and sometimes the disappointment that comes along with not conceiving, it's really stressful. And we want to make sure that we're looking holistic, so mind, body, spirit. So I'm interested in bringing someone on our team who that's their specialty. So stay tuned. The team will continue to grow. Our guest today is the fabulous Akilah Shaeed. Oh my goodness, she was born and raised in the East Bay area of Northern Cali, known as Black Panther Flower Child. She advocates for the rights of women. She is a doula. She's also a lactation consultant or breastfeeding peer supporter. I messed up the title. My apologies. She has been working in women's health. Oh my goodness, since at least it says 2015, she began working in the medical field with this arena. So we got a good 3 years. She became a doula though back in 2009 after the birth of her son. And I'm sure she'll share a little bit about why she became a doula and how that journey of pregnancy and birth let her realize that there was definitely a need for this kind of advocacy. I met Akilah about a year or so ago at a natural health event as part of a wellness team I'm a part of. Her spirit is beautiful. Her energy is wonderful. So when I thought about, okay, doula, heard the word, I'm going to need a doula on my team. Who do I call? I was like, oh, I would call Akilah. And so today she's going to really break down for us, what do doulas do? why do we need one on our birthing team? And how does one go about, selecting one, like everything you need to know that we can get into this call, at least on doulas. But Akilah is also in our group, the Fertility Family, which is our private membership group. So you have questions, you'll be able to go into the group, ask some questions, and get them answered. So it's a wonderful resource. You guys did not come to hear me talk today. So without further ado, I'm going to pull up our featured guest, Miss Akilah Shaeed.
Thank you for that beautiful introduction. I am very thankful to be part of the Fertility Family. Like I said, I've been a mom for 8 years. I've always loved the process of birth. Always wanted to be interacting somehow, but I wasn't sure exactly how. 2009, I gave birth to my son at a hospital. I did try to opt for a home birth because I was interested in natural birth. And when I think of hospital just with me, it kind of brought up some fears. So in California right now, currently, I was forced to go to the hospital. I had a beautiful natural birth. I doulaed myself using knowledge that I had, I seeked it on my own. I did take some of the information that I got from surrounding ladies who I'd known had children. But like I said, I couldn't find anybody who had my type of birth that I was trying to obtain. And so I went into the hospital with my handwritten birth plan, handed it to the staff, and I began the process of labor. 7 hours, my first baby. I did have gestational diabetes. I was aware of the complications and the risks that came with it. I was very diligent as far as my diet, and I kept my sugars at a good level. That being said, I gave birth to my 9-pound, 5-ounce, 21.5-inch son named Jahiran, naturally, which means vaginally with no pain medication. After of which, my placenta was pulled without my knowledge and not with my permission. And I did hemorrhage. And so that was a complication that came. I survived, thank goodness. But after of which I did a lot of research. And I saw that my case was not uncommon. Right now, as you can see, and I'll give you more information within the presentation, but right now a lot of research needs to be done by all women who are deciding to become mothers. This is our health, but once again, when you're going into a hospital or if you're in a home birth, it is your life. You are, in an essence, going to have to fight for yours and your child's because it's a process. It's a natural process and it's a beautiful process, but you have to do your due diligence and you have to have knowledge of self about what you are able to take, and also, where you need assistance and where you need support. And that's kind of where doulas come into. We are those little birds, dropping a few seeds of knowledge and hoping that you're thinking about things all the way out. You know what I'm saying? Sometimes we plan and we try to plan, and I'm going to assist you in planning. But when we're doing it on our own and we're just relying on our immediate family, life sometimes get in the way and we're not able to manage stressors. So it's good to have somebody who is professional, because that means that in my downtime, I am really doing the research. I'm really using other people's experiences to help mold what you desire to be your pregnancy and also your birth and after postpartum. How do you want it? What are your desires? So please bear with me. This will be my first online presentation here. I usually am a word of reference doula, meaning all of my clients come from someone that I have previously served. So without further ado, what is a doula? So it's an ancient position, even though this term is just now coming up, and it is Greek and it means a woman's servant. The role has been ancient as far as support for the mother during natural childbirth. Right now, it's one of the #1 growing careers because maternity is seeing a need. Our maternal mortality rate, that means the rate in which women are passing away or transitioning in death during childbirth, is actually growing. And so there's an alarm that's being risen because we want to make sure that we're having healthy babies and healthy moms after the beautiful process of birth. So family members, usually family members are here and they are used to support, but not everyone has a traditional family setup, and not everyone is able to count on their family members for certain areas of support. So when thinking about a doula, really concentrate on, am I comfortable with asking my mom certain things? Am I comfortable with asking my dad for certain things? How comfortable am I asking my family for help? When we first think about it, it seems like a really easy concept, right? Hey, mom, can you grab this for me? But when we're talking about intimate settings of healing within your body, are you comfortable saying, today I just don't feel like getting up out of bed? How can I handle my responsibilities when I feel like this? So a doula is an objective person that's there for you without judgment to assist you in any way that surrounds your transition of becoming a mother. My purpose, like I said, and a doula's purpose is we are here to save space for what you need. What do I do? I utilize knowledge of anatomy and physiology to meet the comfort need measures needed for pain and management during birth. We typically think birth, we kind of get it. We engage in the act of making love. We go ahead and we conceive, and then I have to grow the baby for 9 months. I go into labor, I pop the baby out, and there we go, right? Easy. Not exactly. Labors take different lengths of time depending on the mother's self-knowledge and her willingness to trust her body in this process. And so when using anatomy and physiology, I definitely like to use what is called visualization. That is taking time to sit and meditate and focus using visual aids or pictures, as well as descriptive conversations, where we would actually walk through the process of labor, what that looks like inside of the mother's body from conception, what it looks like as far as her growing the baby for the duration of 9 months, or however long her pregnancy lasts, because each pregnancy is different, even though we average around 40 weeks. Some come early and some come a little bit later. All of that is okay. Everybody has a different normal. So once again, we would go through what that process looks like in order to help her adapt. So labor is about adaptation. It starts off a little bit light. It increases as you continue. And then right as you feel like you can't take anymore, that's when the baby's there. So we're there to make sure that mom keeps a level head and she's able to go ahead and understand that process so that she's not filled with fear once the process begins. The process I'm talking about is labor. Like I said, emotionally, there are a lot of things that happen emotionally with your bodies physically changing. And so how do you address that? If a mother is concerned with weight, how is she able to manage that without racking her brain about calories? I definitely do not want stress to be a cause of miscarriage, which is very common. It's also, a precursor of what we would say infertility. But like I said, I don't like that term either because I think it all involves blockages as far as energy. Assisting the partner and the woman preparing for labor. So both partners need to be on the same page as far as what labor is, how the mom needs to be supported. Some women prefer to be touched and to be constantly rubbed, and some women prefer to be left alone. Some women like it silent. Some women prefer music. Some women need coaching as far as prompting because they get lost in their own thoughts. So it's all about thinking about what do you need in support. And that is what a birth doula is there to see, to ask questions and probe you to see what are your fears. Let's break those down so that you can get your desired birth. I will stay with you during your entire labor. So preterm labor, you can be in labor from 0 to 4 days without being in active labor. So you can still be having contractions. You can feel nauseous. You can have flu-like symptoms. So I am the type of birth doula that I would come early on and comfort you and make sure that you're progressing normally, and there is no timeline when it comes to progressing normally in the first stage of labor. Once again, that can last from 0 to 4 days. Providing accurate and clear information so that you may make your own informed decisions. I am here to provide you with as many options for labor, comfort measures, and postpartum care that you need. Um, I facilitate communication between laboring women and her birth team. So, who would you like in your labor room? Is it going to be your aunt, your cousin, a couple of your friends? Is it going to be your mate? Who would you like there, and what role do you want them to play? When we are talking about birth and we're talking about a very vulnerable time, is there anyone in the room that you're uncomfortable seeing parts of your body, that you would feel uncomfortable or maybe start to question yourself when the labor song begins? The labor song is what I call the moans of women. All women have different sounds. It is when she has reached a delta wave. A delta wave in labor means that I have blocked out my the immediate surroundings. I am totally in depth in the process of what is happening. I am totally present within my body, and I am using my energy to guide my child out. It is very important that when you're thinking about your birth team, that you have people around you that will support this act, and not, take away from it, not pull the attention to them. So that's what we would definitely talk about as a doula. My purpose is to nurture and protect your memory. As birth, it's beautiful. We definitely, regardless of what happens, when someone asks you 3 years down the line, how was your birth experience? Definitely don't want you to say, oh my God, it was the worst. It was so painful. It was horrible. And it was just this, and all these complaints. Instead, what would the world be like if women who talked about their labor expressed it in, it was the most beautiful and transformative experience of my life. It took me to the brink to where I thought I couldn't do anything and I had no more to give. And then all of a sudden, strength. It was nothing but strength. I felt amazing, phenomenal. I gave birth to my child in this manner. I caught my baby and I pulled my baby up on my chest, put my baby up on my chest and breastfed. What if? But that's if that's your desired birth. I'm here to support whatever type of birth experience that you would like. What don't we do? We do not perform clinical tasks. I won't be taking blood pressure, giving vaginal exams, or giving you any type of diagnosis. I'm here to brainstorm once again, and I'm here to provide emotional and physical support. Making decisions for you. Definitely don't make decisions for you. I am here to provide you with information so that you can make informed decisions for yourself. An example of that would be, I really don't want the epidural, but I do want pain management. Okay, let's see the pain management options and let's see what hospital you're delivering at. Furthermore, let's see what medication this particular hospital is, what brand, what type of medication, because we do have a generic basis, but then you have different companies that buy that product and then manufacture their medication. Each company may have different ingredients in it, and that may or may not agree with your body, your system, or your beliefs. So it's very important that you do external research when you're asking those simple questions. It's not so much of what type of pain medication do you have? Oh, I have IV medication and epidural. That's it. Definitely to ask for more, speaking to staff on your behalf. If you decide for a hospital birth with a doula, we are not there to buffer or to speak on your behalf. We're there to discuss your concerns and your suggestions with you. So in a scenario, your doctor would come in and you guys would have that conversation. I would be in the background, listening, observing, and making sure that you're clear on everything. I would advise not making decisions as soon as the doctor talks to you, but thank you so much for your information. Ask them to excuse themselves and then let that information sink in. Once again, we would brainstorm about what your desired birth plan is and see if the doctor's information will change that. And if it does change that, what direction you would like to go based on your desire. We're talking about facts. So everyone has their opinion about birth, but what is going on? Facts. Why are doulas important? Why is my role being shown now in 2018 as a very growing career? Like I said, I've been doing this work for about 8 years, but I took 1 year. Last year was actually my first year being a doula full time, dedicating a majority of my time for saving space for families and advocating birth rights for women. So scientific research has shown that having a birth doula present during childbirth can reduce these factors: cesarean rates, your length of labor. So cesarean rates are very, very scary. I know we listen to them and they seem very normal because so many women now are scheduling them. But if we really get down to the basis and understand what is happening, that, you know, if we can avoid at any cost your body being opened in a process that's unnatural, I think it's a good idea to avoid it. Majority of the cesarean rates also occur after a woman has progressed through her labor. So your scenarios are women being in labor for maybe, 9 to 10 hours, and then being, hey, the doctor is encouraging, okay, you've been in labor for this long, we're going to go ahead and start having you push. The baby wasn't at a correct position in order to push. So mom begins pushing, her cervix ends up swelling, and then her labor stalls. Now we have an emergency C-section. So just to give you an idea of the scenario of what's happening when these cesareans are happening, the 50% isn't necessarily the ones that are scheduled. They're actually the ones that are emergent and can be avoided by having a doula coach present. They're giving you information so that you can listen to your body and assess what's happening. Length of labor. Who wants to be in labor for 13 hours? I don't. I think a lot of first-time moms wouldn't, second time, third time, fourth time. I don't think anybody wants to be in labor for that long. So like I said, I had a huge baby, not that big, but 9 pounds, 5 ounces, first baby, and it was 7 hours. From water breaking to him being brought onto my chest. So it is possible. Doulas being present, we are knocking those hours down. It's all about preparation. So before you get pregnant, you can be doing things within your body so that you make it easier when you do become pregnant. Once you're pregnant, there are exercises that you can do every day that will lower the length of your labor. The use of Pitocin. Pitocin is that big bad boy in the hospital, and it is given out like candy. No problem if you need it, but what Pitocin does, it creates contractions that are not natural. So they are 10 times or almost 100 times worse than your regular contractions. So when it comes to our 38-week mamas and our 39-week mamas, hold on. Just hold on. That's my best advice as a birth doula to give you, is to hold on and allow your body to naturally go into labor. Use of pain medication, like I said, there are IV pain medications, there are anesthesias, but we want to avoid pain medications if all possible, because pain medication messes up with your neurons and your receptors. And so your body has a process that's occurring, and you are introducing medication that is going to confuse your neurons. So we're assessing pain and uncomfortability. Now I don't assess any pain. So I'm going to slow down the other processes because I don't see a need. I have to figure out now what's going on with the body. I thought we were in labor, but all of a sudden you've calmed down completely and you've relaxed, and now you're not working. So when we're talking about labor, remember that it is work and that it has yet to pay off. As soon as all your work is done, labor's done. And then the fun start parts, parenting. So yes. And forceps. So we are in 2018, people, and yes, we sometimes are still needing forceps. They are a very scary tool only because of the side effects. The side effects are can be very severe. I'm not going to scare you too much on that. I think further research needs to be done on your part if you are opting for a hospital birth. We're going to avoid forceps by avoiding epidurals. Epidurals are one of the leading cause of forceps because mom can no longer feel what's going on in her lower region. And so a lot of the situations that we come up on with forceps and also vacuum suction is because of epidurals. And once again, we are lowering requests of epidurals by 60%. Epidurals are known to extend your labor. So and that's up to 7 hours. And it also increases your cesarean rate. And so I like to call an intervention connection, and that's what I'm trying to explain. Once you begin one intervention, it is more likely that you're going to introduce another, and then another, and then another. What happens is they start connecting the dots, and we don't exactly want these to connect because every intervention confuses your body, and it makes it harder for your body to assess what's going on in labor. So that is why, once again, that I said a doula would extensively go over the anatomy and physiology so that you know what's going on in your body, what hormones are being released, what is causing those hormones to release, how I can continue on the releasing of these hormones so that we can progress. Progression equals baby. All right. Hope that is clear. So when do you want to hire a doula? As soon as you think that you would like to conceive. A good example would be buying a house. You know, a child is a huge investment. It's a life-changing investment. There are a lot of other factors that can play into the part, but the point is, this is your investment, your baby, literally. So you want to do as much research and prepare as much as you can. And so the best thing to do that is to speak with what would be considered a professional birth consultant or a birth doula, where she can let you know, okay, when do you want to conceive? Maybe next year. Okay, what is your diet like? What does your lifestyle look like? And that gives what leads us into my next slide. Is your lifestyle or our society that you live in, is it baby friendly? What type of work do you do? Are you out of the house for 40 hours? Not saying that's a bad thing. If you work for 40 hours a week, okay, and you're thinking of being conceived, what does your work look like? Are you sitting down most of the time? If you are, how can we integrate some movement? Because if you're going to be, when you get pregnant, not if, when you get pregnant, you will be adding on extra pounds. Your ligaments are going to stretch out. You know, your muscles are going to fatigue a bit. You're going to need a bit more sleep, a bit more rest, but then you're still going to need to be active. So what type of snacks are you able to have? Do you have a refrigerator at work? You know, do you have a microwave? These are all of these factors that we tend to not think about until we have the baby and we're 6 weeks postpartum and we're supposed to be going back to work, and then all of a sudden it's like, oh my gosh. Or we're 3 months into the pregnancy and we're miserable at work and we're like, oh my goodness, I can't do this for another 6 months. Please schedule my cesarean. So these are the type of things that we have to think about, and the things that you kind of want to brainstorm and have a set desire, and then work on the steps to achieve that desire. Your activities. What do your social activities look like? On the weekend, are you out at the club? Do you like to sleep in? Do you like to be out with nature? How will you do that pregnant? How are you going to do that pregnant? Are there any of your other friends pregnant? You know what I'm saying? Is your social circle going to change? Are they supportive of the baby? Are they going to be supported and active? You know, because if not, okay, let's look for some mom support groups or some mom active groups. Do you like hiking? Let's find you a group with mommies that like to go hiking as well. That way you can enjoy this journey versus this journey doing what unfortunately it has, you know, and that's why we hear so many cases of postpartum depression, because women are becoming isolated. And they become isolated because they did not prepare and shift their lifestyle into a baby-friendly lifestyle. So while we're talking about social life, we also want to think about environment. Do you live in an apartment? If you're going to have a baby and you're living with an apartment, how are your neighbors as far as noise? When baby starts to walk, how is that going to be? As far as your environment, do you live with someone that smokes? If you live in an apartment building, do you guys share a ventilation system? If they light up a cigarette, are you going to start breathing it? And that actually literally happened to me, and I live in a condo, and I didn't think about it. And we're homeowners, and so when I began to smell secondhand smoke, it was this big, huge ordeal in order to ask them to please smoke outside because it was affecting my health and my infants. So those are the things that you kind of want to think about when we're talking about is our society lifestyle friendly, is our baby friendly. I see a lot of dog parks. Do I see as many baby parks? Do I see as many parks, for children? So that's to think about. Where in your community are you located? What are the fun activities that you could do while you're pregnant? All of those things factor into, conceiving a life. Our maternal mortality rate right now is 26.4%, and that is rising. And this is a new conversation, but once again, we are what's considered a developed country, and this rate definitely should go down, and it is going down once more women decide to exercise their right to have support during birth, and that is of a doula. There are community doulas. There are which some charge. Some have nonprofit organizations, which I'll talk about in the next presentation, how to contact your local doulas and all of their resources, because we definitely want to get a hold on this. Stress. We hear this word so much. When you become pregnant, you're thinking about becoming pregnant, or you've just had a baby, you will deal with stress. The good stress. Good stress when we're talking about pregnancy is the extra fluid. That's something we usually don't think about, but extra fluid puts extra pressure on our joints, puts extra pressure on every single organ within our body. So that means that we're going to be using more work just because we are growing another human being. So why is this good stress? Because it's good. We have to do this in order to make a baby. We have to prepare our body to do this. And so this is the good stress. Now, when we're talking about bad stress, what is bad stress? Bad stress would be me, I'm frustrated. And instead of me doing some exercise or something like that, I'm going to eat. So this is a prime example. I'm going to eat. And it's something that a lot of us do unconsciously. But when you're pregnant and you're thinking of conceiving, I'm going to eat, or I'm going to sit down, or I'm going to stew in the negative thoughts about all of these stressors. It could be money. It could be your car maintenance. It could be anything. But bad stress is stress that's not necessarily natural. Good stress is a natural process. So you becoming pregnant and putting strain on your body, because that's what it is still healthy. You're going to be okay from it. Bad stress turns into chronic illnesses that we cannot get rid of. So it just boils down to, how do you handle it? Come work with a doula. Yoga is a beautiful way. But if you don't have an hour out of your week, let's figure out some other things you could do around the house. It's all about tailoring your life to fit your lifestyle. And you definitely have the power to change your lifestyle. And I think in deciding to have a child, that's a beautiful start. That's a beautiful time to start implementing things that will change your life for the better. Quick fixes and rituals and routines. So like I said, yoga would be something that would be considered a ritual or a routine. A ritual just means something that you repeat on a regular basis. So a cup of coffee is someone's ritual in the morning. That's something that you do kind of automatically. You started doing it one day and then you just kind of began doing it. Our quick fixes for stress: citrus fruits, essential oils, lemony citrus, eating them can flip your mood around. Bananas are another good good stress relief, or as I would say, a quick fix. And then candles and controlling your environment in such a way that automatically kind of brings your stress down. So certain colors have that effect on us. So really kind of being mindful of what stresses you out. It could be something as simple as you driving and hitting traffic. That can spark a mood. And then, we want to see, I would hope that you would have like an orange, and then you would be able to go ahead and control that mood. And so like I was saying, once again, this is just an image of what to expect when you're expecting. And this will definitely put stress on your body, as I was talking about, because all your organs are shifted around. So how do you think you feel physically? Most likely uncomfortable. So if you're uncomfortable, the moment you wake up, it's definitely going to be, you're going to have to work at maintaining a good attitude and really work on a positive mindset. And that's what we want to have in order to have healthy mommies and healthy babies and healthy and beautiful conception. Yes, childbirth education. Definitely very important that before having a baby, I recommend people learn about childbirth. Really learn about the process. Really learn about the anatomy, meaning scientifically, what is this called? Where is my cervix? It's very important. Trimester. So I put 4. Usually we have 3, but I include the first year after birth as a 4th trimester, because the baby is not fully developed. Intestines are still being tweaked. Lungs are still developing. Brains are still developing. The skull is still being developed. As for mom, she is transitioning from being literally an open, beautiful cavity after birth. Her hips need to fall back into place. Her hormones need to come back into balance. And hopefully she is breastfeeding. And both of those acts will normalize the hormones in both mother and child. So a lot of the time we have what happens is SIDS, which is sudden infant death syndrome. It's most likely happening before that first year. And a lot of these SIDS cases are linked to a lack of breastfeeding, because breastfeeding not only provides all the nutrition, but also the bond that is needed for a baby to remember to breathe, to remind their bodies to breathe, and to remind their neurological system to work. Because once again, this is an infant and a being who has been inside of another being for their entire lifespan. And to be pulled out, you have to gently transition them into living here on Earth. So that first year, I definitely want to begin the narrative of women focusing on that first year as really bonding and making sure that they're giving their child the best health. And that starts with breastfeeding and usually a change of lifestyle. So body changes, what to expect to your body. Women are usually concerned about their breasts. If I breastfeed, I heard they're going to sag. Gravity, can't fight it. We can work on some exercises, but definitely that's an okay concern. And a birth doula is who you would go to. We definitely can provide information about body changes, how to adapt with your body changes. I had mentioned earlier, I am a hip closing practitioner. It's an ancient practice, and I was taught by an ancient indigenous woman, Mai Tai, who's out of Dallas, Texas. She is a doula as well and a womb massager. This skill is an ancient practice, like most are that I practice and try to explain to everyone right now that's listening. Thank you once again. Hip closing. So when you are giving birth, your pelvis actually expands out and opens. Your hips do. They open. So you'll hear the phrase sometimes, she got them baby making hips, or she pops those hips out. It's literally your hips do pop out. And so a lot of us in America, we do not get them closed. And so what ends up happening is after birth, even if we didn't have an epidural, which is one of the leading causes of back pain, we still get back pain. Knees start hurting, our hips start hurting. If you are in my, let's see, my mother's generation, so in your 50s right now, 50s and 60s, there are a lot of hips that are knocking out of socket, they're falling and they're breaking. And we think that one of the causes is from vitamin D, but it's also from childbirth and not having those hips closed. So we definitely want to address those body changes. Emotionally, it will be a roller coaster. Some days you're going to cry. This is prior to conceiving, prior to conception. Moments of realization during your pregnancy. Oh my goodness, it might hit you one day, you're sitting on the car and really just start thinking about the responsibility of it. And we definitely want you as a birth doula to not take on that responsibility by yourself, but to remember that you have a village. And so in those moments, it's definitely useful to have a doula, and definitely beneficial to be able to bounce off any fears or concerns with someone who is objective. So someone who will not be immediately there with the child, so that you don't feel self-conscious about feelings of sometimes unworthiness or inadequacies. It's okay to have moments like that, as long as you're able to bounce back from it. Spiritual will. So it takes will. It takes will to be a parent. It takes will to become a parent. It takes will to go through labor. All of these acts, it takes a will. So I definitely want to make sure that we're building up our will for our desires. If your will is a natural childbirth, then we're going to build up and use techniques that will strengthen that will. If your will is, hey, I am dead set on having it in a hospital, and I don't want the baby on my chest first initially, hey, that is your will, and I will be here to support that desire. Absolutely. Oh, and chemical, because I kind of skipped the slide a little bit, but chemically speaking, hormonal changes, postpartum depression, feelings of elation immediately after labor, all of those are thanks to our beautiful hormones. And so within dealing with hormones, we deal with moods. We also deal with words that sometimes we don't always want to say, or shouldn't say. And so in those moments, it's always good to have someone, once again, that's objective, that's out of the situation, that can see clearly and bring you back to the point, which is a healthy baby and healthy mom. Regardless of the feelings, you definitely will be able to do it. Regardless of how you feel, you can do it as long as you have support. So our next slide, as you can see, this is an ancient practice of a woman squatting. What type of birth do you desire, or do I desire? This is something I would like you all to think about. What type of birth do I desire? And really think about it. Do I want to be in a hospital? Do I want to be in a birthing center? And when I'm in these areas, whose agenda am I following? If I go to the hospital, are they still going to be thinking about my agenda and my desire? Or are they coming from an agenda of, we want to make sure that our rates are here? How many beds do we have filled? How many women right now do we have in active labor? How many rooms are open for cesarean? How long have these 3 patients been here? You know what I'm saying? All of these different factors that are not your concern, but that do and may have an impact on your desired birth. So once again, thinking about the clock. Am I okay with being put on a time limit? If I know the time limit, am I working so that when those 8 hours come, I'm not worried about the 8 hours. I can feel the 8 hours, but I'm confident that I'm going to be through and into active labor. You know what I'm saying? What about range of motion? Are you someone that wants to move around? Moving around during labor progresses labor. Gravity is your best friend during labor. So in a hospital setting, how are you going to be, how is your range of motion? Are you going to be free? Can you take yourself off the monitor for a certain amount of time? What happens if you have to be on a monitor? You know what I'm saying? Just making sure that you gather all the necessary information. And then limited control of an environment. If you're someone who likes to light candles, do you have you might not be able to light those type of candles. If you're someone who likes incense, you may not be able to have incense there because of safety. They have oxygen in the room, then of course you can't light anything. So do you have diffused oil, essential oils? Will that be enough? Will you be okay with someone waving the essential oil, or do you need it to be pumped through the room? So all of these things are beautiful to think about. I definitely don't want you to stress while you're thinking of it, but these are the types of in-depth thoughts processes that that definitely need to be implemented when we're thinking about our births. Policies and procedures, once again, some of your desires may not fit into your hospital's policies and procedures. And you have the right to assess, is this something that I can be okay with? Or is this something that I'm gonna have to go and seek more options? And then once again, I was talking about ratings. When we're thinking about ratings, this was more on the hospital's agenda and birthing center. When you're looking up hospitals and you're looking up their experiences, take it with a grain of salt. Everybody's experience is different. So definitely make yourself aware of the stories from that hospital or birth experiences from that hospital. But if you're delivering at a hospital, do not carry those stories in with you. Okay, hospitals are doing their best, and I definitely commend them on welcoming doulas into their maternity wards. And then what do the numbers look like? That was once again thinking about it. What do numbers look like money-wise? What do numbers look like? We're always thinking about numbers. How many people do you want present at the birth? Different hospitals have different numbers. I had 14. Definitely don't recommend 14 people. Like I said, that was my first birth. That was the support that I felt like I needed. It was a lot of different types of support, and I felt I needed all of that in one room. And then we're thinking about cost. What does your insurance cover? Because some insurances are covering doula services. So like I said, we're making leaps, and this industry is growing because the need is definitely there. So in thinking about your birth, check into those finite coverages and ask a copy of your insurance. Can you please send me a detailed list of what is covered? So that when you're planning your birth, this might be something that you ask them. It may not happen for you, but it may happen for 5 women down the line in 3 years. You know what I'm saying? Who knows? So we definitely want to ask. So when we're thinking about money, once again, like I said, what is covered? Sometimes when we're thinking about, I want to go ahead and get a midwife, we think that they're so expensive that we don't even do the research, and we just stop right there. And it's like, nope, I can't afford anything. Insurance is just going to cover it. So I'm not even going to, look at that. But definitely do not count yourself out depending on your financial outlook. Never allow money to prevent you from getting what you want. You know, the universe, I definitely believe it will provide it if you seek it. So that is another thing that a doula will assist. When we're thinking about free birthing, the number one thing, and yes, I am a bit biased because I just experienced a home birth that was just absolutely beautiful. She can eat. I know this is something that we don't really think about during labor, but it's very, very important because it's all about energy. And within labor, you need energy. So we definitely want to make sure that you can eat. You would have more control of your environment and a safe space. Do you consider a hospital a safe space? If you think about hospitals and you start getting memories of people who've passed, or you have fear, that's what I'm saying, coming up, unless you're able to adapt to that, maybe a home birth would be your way to go. Once again, different states have different laws. I am currently in California. Georgia is unregulated, so home birth. In California, you will have to get certain legislation passed, and it does different between county. So once again, we are making leaps, but it really takes women demanding what they want in order for change to take place. Some other things to think about: why do hospitals keep the placenta? Does every mom need an IV? These are an IV adds more fluid, like I was talking about fluid earlier. Fluid adds pressure, and pressure towards your cervix, which is where the baby has to come out, we want that to disappear. We want it to thin, and the extra fluid that IVs provide actually swell it. And that is another reason why we sometimes end up in cesarean. I am looking at the time, and I think I did it pretty good. I'm doing good. For the most part, we want healthy mom and healthy baby, right? And so the best way to do that is to establish breastfeeding within the first hour after birth. As your rights as being a human being, you can ask your hospital to pause any procedure they need to do before, so that you can establish a good latch. The risks of not breastfeeding will outweigh the pain. So it will be uncomfortable the first few weeks. And after that, hopefully you have a good support like a doula or an IBCLC, which is an international lactation consultant. But we definitely want you breastfeeding. It's good for mom, it's good for baby, and it's good for our society as a whole. If all else fails, I would like you to use your brain. When you're thinking about decisions that you're making, definitely think about the benefits. Think about the risks. What are your alternatives? We always have options and alternatives. What does your gut say? Your intuition. I love to use knowledge because knowledge is power if implemented correctly. And the only way it's implemented correctly is if you follow your gut, especially when it comes to your body. No, not nothing at all. Sometimes we do get overwhelmed. Sometimes we have so much information, we don't know how to decipher it. It is okay to do nothing at all. It is okay to sit back, reflect, and allow the answer to pop up instead of stressing. So yes, and this was from my instructor, Miss Nakia Lawson of doulabirthblessings.com and anaturalway.bp.org. She is a beautiful doula instructor. And so I thank you. It ended so fast. But I definitely want you guys to take away, if you didn't take away anything, take away this. This is a fortune cookie. It's actually mine that I got the moment that I decided I was going to dedicate my life to birthing justice. And I quit my job, went out on a limb, and I went and got some Chinese food that I no longer eat because too high in sodium. But it says, don't give up. The beginning is always the hardest. So like I said, that is my website. I'm here for support, and there are so many other sisters who have so many different walks of life. Find your doula and find your support team just like you would your mate or anyone else significant. It is about energy. It's about who brings the best out in you and brings out your strengths. Doulas are here to save space. Thank you so much for participating and watching. And I'll check in with you next week.
Right. Sorry. Oh my goodness. What?
You.
Well, I just want to acknowledge you for a wonderful presentation. I got notes over here. I'm like,
Yes.
So, I said, when we decided to do this, it's just you and me chatting, right? So I've got some questions if you're open.
Yes.
All right. So I'm going to put this back on you, and I'm going to ask my questions. All right. Okay. So I noticed you use the term birth doula. Are there different types of doulas?
Yes. So I am a full spectrum doula. A full spectrum means that I provide support during miscarriages, abortion, live births, meaning I'm there at your labor, and then up until 2 hours after your labor. And then I would come back to do follow-ups for breastfeeding. Then there's postpartum doulas. I also am a postpartum doula. So that means after baby is home and you just hit that 2 weeks and all your visitors stopped coming by and now you're left with the baby and your breasts are sore and the laundry's not done and you're just like, okay, oh my gosh. I'm there to say, hey, I got the laundry. Go ahead. relax, breastfeed. I got it. What would you like to eat? Or it's 2 a.m. in the morning and baby's not latching and you're tired and your partner's out here and hey, call and I don't know what's going on. And baby, do you need me to come by? Yes or no? If you do, I'm there. If not, we can FaceTime. And you know what I'm saying? And calm the situation down. So those are all the different type of doulas. And then, like I said, once again, for abortion and miscarriage, I do definitely acknowledge those as being processes that need acknowledgement and need healing. Just like birth, you know.
Awesome. So, okay. And I was like, you were talking about like the length of the birth. I think about like my mom was in labor for my sister, like 33 hours.
Ooh,
that was like 40 some years ago. She would definitely probably had a cesarean, but you listen, that back in the day, you did what you had to do, right?
Yes. And then I would ask too, like I said, active labor doesn't really, active labor is when we actually start the clock. So she may have been in preterm labor, meaning we're sitting here, it's not yet. I'm in early term labor, I'm uncomfortable, and that can go on for days. So it sounds like that may have been.
I mean, but she said the distinction, like me, I was like Speedy Gonzalez, so she thought she had forever. And my dad always tells me they barely made it to the hospital. Like she was like within like a couple of hours. I was like, "What's up?"
Yes, each baby gets shorter. It's supposed to get shorter. Okay. But I like to start off saying, "Okay, well, good. So 8 hours. 8 hours is the goal,
or less."
Well, yes, and then the rest, cutting down. So yeah.
And so you talked about exercises and things that you can do before you're even pregnant.
Yeah.
I was like, whoa, I never heard about prenatal. I mean, I've heard about pregnancy yoga. I've heard about like pregnancy massage, but you're talking about prenatal, like, yes. So that was just like a one. I was like, wow, that's hype. Oh my goodness. So at some point we're going to figure out how to do the camera where you can like go live and show us some of these.
Yes, I have the presentation. I was just trying to brainstorm on how I would actually go about that. But I think I have an area which I would present and that would give me enough room. And I have the tools. So yes. Yeah.
And then in terms of pricing, just can you give us an idea of like what kind of budget? Like, I know it can be all across the board, but can you give us any idea of like what kind of cost would be associated? Because one of the things we are looking at, we do have one of our team members who talks about financial planning for baby. So like what if we were like looking at, okay, I know I want to incorporate a doula into my whole pregnancy process. Right. Yeah, what am I looking like?
So like I said, I'm in California right now. So the income out here, the average income is different. So right now in California, $2,500 is your base price for a birth doula. In Atlanta, when I was in Atlanta, $800 was the price. So I think anywhere between $600 all the way up to $10,000. I mean, it depends on.
I'm not ready for the Beyonce level doula.
But that's with everything, and not saying, the more expensive is better quality. Definitely not saying that. It's all about, you know what I'm saying? It's about, once again.
I mean, like, if I'm paying 10 stacks, you are my doula. I mean, like, baby girl, wait a minute. No, listen, it's quality, not quantity.
Yes, because you have some doulas that come and live in, you know what I'm saying? It really gets, when we talk about like support and care, there are some women and some families that really need support and have the financial money to be able to do that.
Or if you're going to be a single mommy, I'm going to be a solo parent. So I know that I'm going to need some intensive support. So that's like the other thing.
Somewhere around me, because I'm not going to hit you with the 10,000 at all, but definitely, would be open to being there. Do you need me physically here for the first 2 weeks? You know what I'm saying? That's definitely realistic, and it's doable. So when you're thinking about that, I think that people should budget and change their priorities a bit. I think just as a society, we have to kind of reassess where our priorities are. If you go and get your nails done every week or every 2 weeks, you can afford a doula. You have 9 months of the actual pregnancy. Like I said before, if you're planning, then you have ample time. As soon as you start planning, you start thinking about it. Okay, let me save $5. Right now, my practices for my next birth, I don't spend $5 bills. So any $5 bill that I come in contact with, I rubber band it and put it in a box. And it's that simple. So, you know, that's just how I would plan for that.
We're going to create what's called the BSP, the Baby Savings Plan. We're going to start, we're going to talk about it. I like it.
$5. That's what I do. I think it's important. It's like, you know, it's like walking into, how can I make an example? You're walking onto a football field, and you're about to play a game and you have no linemen. Is that a good example? I'm horrible at like analogy.
I don't know what linemen do. But for me, the doula, like literally how it occurs to me from everything you shared, the doula is like the event planning or the wedding planner. And people always think, oh, what do you need a wedding planner for? But let me promise you, as a, like for me, as a former event planner, people, when they try to plan without us, they're like, yeah, next time I'm going to have a planner. So people don't realize everything that goes into these areas of life that, you know, they happen all the time, but, you know, they take something. So before we complete, is there anything last minute thinking, oh, I didn't mention anything else you want to share before we complete?
Trying to think, it's just so much. No, not really. I think just this is an enjoyable process. I just want everything related to birth and babies and being pregnant and, you know, gaining, you know, 50 pounds, 40 pounds, whatever. Everything that's involved in it is beautiful. You know what I'm saying? I think I just want that to be conveyed. Outside of that, ask questions. Always ask questions. Ask questions, ask questions, ask questions. Yes.
All right, so folks, we have completed Fertility Family Live, our doula presentation, where we got, I mean, I learned a lot. I mean, the hip closing is something brand new to me, and it makes perfect sense. It's like, obviously that'd be a practice.
Oh, so, yes, and sorry, I didn't mean to interrupt you. Womb placement practitioner. Sometimes our wombs do drop down low. That can give us heavy periods, bladder incontinence, and other nasty issues that we probably won't get into. But if you do or do come in contact with that, I literally move your womb up in its proper place, and that helps with digestion and every other process within a woman's body because her center is her womb. So take care of it. Look, now I'm done.
So this was just the tip of the iceberg, folks. Yeah. So inside of the Fertility Family, what's really great is it gives our practitioners some more opportunities to go live. So in the group, they may pop in, do a quick presentation. So you want to make sure you're in the group. If you're able to watch this, you know, this is our launch phase. So you're getting some great content. I urge you to go ahead and formally join the Fertility Family, so you get direct access and more resources. My name again is Kania Kennedy. I'm the founder of the Fertility Family and a future mature mommy to be. I'm super excited, so grateful. Thank you so much, Akilah. So much great information, and thank you for sharing. Anyone? No, I received that. And for anyone who's watching, if you have any questions, please don't hesitate to find us online. You can find Akilah at AkilahShaeed.com. You can find me at KaniaKennedy.com or FamilyFertilityFam.com. There's plenty of ways to get to us. In the meantime, be well, stay fabulous, and have a happy, healthy pregnancy and birth. Until the next time.
Bye.